Welcome to Using Data to Drive Quality. This video is designed for licensed providers of developmental disability waiver services. My name is Mary Beth Cox. I'm a Quality Improvement Coordinator at DBHDS in the Office of Clinical Quality Management. Here are the learning objectives for this video. At the end, participants will be able to explain why providers need to use data to track performance, describe important data-related terminology, list what data you have available, identify at least 3 ways to use data for your program, and explain how to look at trends in data over time. Let's start by asking why. Why does a provider need to collect and track performance data, including serious incident and other risk information? Pause this video and discuss it for a moment with your team. The answer is that providers need to collect and track performance data to know what's working well and what isn't working well. This is so that they can know what to focus on in order to improve programs and services. This also feeds into their risk management and quality improvement plans and activities. Let's think about a helpful analogy. What does the doctor's office measure when you go in for a visit? You might say something like temperature or blood pressure. Why do they measure these things? You might say they measure these things to see how healthy their patient is or whether they might be sick. Why do they measure them at repeat visits? They measure them to see if there are any changes, which might tell them if the patient is still doing well, getting better, or doing worse. Similarly, a provider needs to measure things about their program to know if their program is doing well or needs improvement. It's always a good idea to start with some definitions. We are going to start by looking at some data terminology. As we will be using the word data a lot, let's start there. Data is numbers that represent information. Baseline data are numerical data over a set time period that a team will use as a starting point. When you have baseline data, multiple data points are preferable. For example, it would be helpful to look at a baseline over a period of multiple weeks or months. At least a year of data is ideal to have a baseline. Calculation is the process of using information and adding, taking away, multiplying, or dividing numbers to judge the number or amount of something. Measurement is the process of associating numbers with physical quantities and phenomena. Patterns are repeatable cycles in the data. For example, if the data always increase at a certain time of year, that is a pattern. Let's continue by starting with percent. This is the calculation that describes something in terms of a part per 100. You would divide the numerator, which is the part, by the denominator, which is the whole, and multiply it times 100 to get a percent. For example, 10% of individuals had a fall last year. Note that you don't necessarily need 100 things to do a percent calculation. We'll talk about this more a little later. Performance data is numerical information that tells you how well your programs and services are doing. For example, if you look at the percent of individuals who had a fall or trip each quarter last year, this is performance data. Qualitative data is descriptive data that uses words to describe information. Quantitative data is numerical data that uses numbers to count things, such as how many or how often. A rate is a quantity, amount, or degree of something measured per unit of something else. An example of a rate is the rate of falls per 1,000 individuals. A run chart or a trend line is a line graph of data points over time to identify trends and patterns. And trends means how you describe data points over time. For example, your data points may go up, down, or not change. Let's do an example of calculating a percent. We want to know what percent of people like rhubarb pie. We're going to remember that the numerator is the top number and the denominator is the bottom. We have a sample of 300 people, and we asked them if they like rhubarb pie, and 23 people said yes. So we have our sample of 300 as the denominator, and our 23 people who said yes as the numerator. So we're going to do a division. 23 divided by 300 is 0.076. So if we stop there, we would say for every one person, 0.076 people like rhubarb pie. This is a very awkward way to say this, and it doesn't really make a lot of sense logically, like if you're just thinking about 0.076 of a person. So we want to make it into a percent, and we simply do that by multiplying it times 100. This essentially multiplies the whole equation by 100 and gives you the result that 7.6 out of every 100 people like rhubarb pie, or more commonly stated, 7.6% of people like rhubarb pie. There's our percentage. I want to talk for a second about something that confuses some people when doing percentages. Those items or people or groups, things in the numerator must have had an opportunity to be in the denominator, which is the bottom number. So let's look at some examples here. The first one here, 5 serious incident reports divided by 25 people. So you need to ask, can those reports have had a chance to be in the denominator, which is people? So the answer is no, reports cannot be people. So the result here that says 20% of people have serious incident reports is incorrect. We'll see later, we'll talk about rates. You can reflect this as a rate, but it is not a percentage. The bottom example here says 3 people had at least one serious incident divided by 25 people. So you ask, can those people in the numerator have had a chance to be part of the people in the denominator? And in this case, yes, they can. So the result here, 12% of the people have had at least one serious incident, is a correct way to do that calculation for a percentage. Now let's talk about the difference between percent and rate. As we just discussed, a percent is a part per 100. Another example here is the percent of individuals experiencing falls. If we have 25 individuals experiencing a fall out of 75 total individuals, the results would give us 33.3% of individuals experienced a fall. As you can see in this example, and is noted on the slide, you don't necessarily need 100 things to do a percent calculation. The number on the denominator can be less than 100. However, a rule of thumb is that the denominator should be greater than 10. A rate is the number of things per some other number, usually 100 or 1,000 or some other multiple of 10. A common example of a rate is miles per hour. An example in our line of work could be the rate of fall incident reports per 1,000 individuals. So in this example, if you have 75 individuals in a population and 10 total fall incident reports, you would have 10 reports divided by 75 individuals times 1,000. And this will give you 133 fall incident reports per 1,000 individuals. Now it's your turn. Let's do an example. Imagine we have a sample of 133 people and 25 of them say they like light blue cars. Calculate what percent of people like light blue cars. Pause the video and do the calculation. If you said 18.8%, you are correct. 25 people divided by 133 people is 0.188 times 100 is 18.8% of people who like light blue cars. Let's do another one. A car traveled 260 miles in 5 hours. Calculate the miles per hour. Also answer, is this a rate or a percent? Pause the video and answer these questions. If you said the average speed was 52 miles per hour, you are correct. 260 miles divided by 5 hours is 52 miles per 1 hour. This is a rate. Let's do one more. There were 5 sepsis incident reports last year, and 250 people were receiving services. First, think about, is this a rate or a percent? And then calculate it. Pause the video and answer these questions. The result is the rate of 20 sepsis incident reports per 1,000 people. If you divide 5 sepsis incident reports by 250 people, this has to be a rate because the numerator does not have a chance to be in the denominator because reports are not people. So this is a rate. So you divide 5 by 250, you get 0.02. And if you want it to be per 1,000 people, you multiply it times 1,000. And you have 20 reports per 1,000 people. Let's talk about when you would use a count, a percent, or a rate. We haven't talked about counts yet, so we're going to start there. Using a count, or a simple how many of something there are, can be sufficient when the thing you are counting is less than 10. It can also be sufficient when dealing with a small number of total items, when comparing simple things between similar sized groups, when you have a small consistent number of people who might have the condition over time, and if the number of occurrences is the primary thing you're interested in. You would consider using a percent when you know the actual number in the denominator, and of those items or people, the number with the condition you're interested in, which would be the numerator. For example, if you know there are 12,500 people, and of those, 500 have pink cars, which would be your numerator, and your denominator would be 12,500, you would be able to calculate that 4% have pink cars. You would also use a percent when you need to make comparisons between larger groups and or over time. And you would use a percent when it makes more sense to express it as a percent. For example, saying 4% of people have pink cars seems more understandable than saying 40 per 1,000 people have pink cars. Finally, let's look at when you would use a rate. We already talked about you would use a rate when your denominator is a different group or expression than your numerator. This cannot be a percentage, so it has to be a rate. For example, the number of miles per hour to measure rate of speed, or to measure the number of incident reports per 1,000 people. You could also use a rate to make comparisons between larger amounts and or over time for these situations where you have a different numerator than denominator. You could also use a rate when a percent is a very small number. For example, the percent of people with a rare disease may be 0.07%, but it may make more sense to express it as 0.7 per 1,000 or even 7 per 10,000. And finally, you would use a rate when the standard or conventional measure is already a rate. For example, standard way to measure speed is miles per hour. Let's talk about output versus outcome measures. When you are looking at performance measures for your program and services, it's important to think about both of these and have, or at least consider having at least one of each. Okay, let's start with outputs. Outputs are the direct product of your program activities. It answers the question, what did we do to try to make things better? So examples might be the number of classes you taught, number of participants, number of incidents reported on time, number of counseling sessions or people who received services or hours of service delivery. These are things that we did that we can count. Outcome measures describe the impact of the activities provided. They answer the question, how are people better off than they were before? Or how are things different, at least, than they were before? This would measure whether people have greater knowledge, more skills, better health status, have healthier behaviors, better living conditions, or better satisfaction. So we really want to get to those outcome measures. So you should really consider having at least one or two or more of those, but definitely not all output measures. Now that we know some basic terminology and have talked a little bit more about some of the details, let's talk about using data for your program. At a high level, here are the things you need to do with your data. First, you need to collect and record data. This entails getting the data that you need, putting it into a usable format. An example of this might be using the risk tracking tool. Then you need to analyze and discuss your data. This involves developing measures, creating graphs and tables, and talking about what it means with your team. And then, finally, you will use your data for improvement. This entails setting measurable goals and objectives, monitoring your data, and tracking progress over time as you make your improvement strategies. First, you need to collect and record data in order to get the data that you need. You probably have some way to get data, but if not, you need to work on getting a structured system to collect data. This might include using an electronic health record or an EHR, using some kind of database like Excel, or even using a paper log or tracking system. Let's also talk about how often to get and review data. It's important to get accurate, up-to-date data. Avoid waiting to collect data. It might be tempting to put off doing it for a day or a week, but this could impact reliability and validity. Over time, we forget or we can make mistakes. It's important to review data as often as it makes sense for the measure or the piece of data that you're looking at. At a minimum, you should be reviewing data quarterly. And also there are certain things in licensing requirements that you have to review quarterly. So definitely pay attention to that. Things like medication errors and serious incidents. You could review data more often, such as hourly, daily, or weekly, and monthly. Like we said, you want to review it at least quarterly and annually. Now let's talk about data you may have available to you. You may have more data available at your fingertips than you realize. Here is a cheat sheet of sorts that is a list of data and data sources that you might have available to you. So I recommend pausing here and noting which ones you have. You could also take a screenshot or take a picture with your camera of this list. You might have data from Chris about serious incidents. You might have data from WAMs about ISPs, including discussions and outcomes, as well as community inclusion and meaningful work data. You likely have administrative data, such as training completion, orientation, hiring, staff retention and no-shows, background checks, performance evaluations, and more. You also likely have other tracking logs that give you data and information about medication errors, peer-to-peer incidents, staff and visitor injuries, and more. You likely also do, at least annually, a family and individual survey and a safety inspection. And finally, you probably have individual health and safety records that could give you data and information about primary care visits, dental visits, missed visits, behaviors, discharges, crisis, tracking logs, and more. Looking at this list, the things that are in the green font underlined with a star align with licensing regulations. So at a minimum, you should have these data sources if you are meeting licensing requirements. Finally, what else can you think of? What else do you have that you could use as data for your performance tracking? Similarly, this is also kind of a cheat sheet of some sample calculations that you could use to measure performance for your program. For example, under serious incidents, you can measure the percent or rate of a certain type of serious incident that occurs in your facility. You could measure something related to abuse and neglect or seclusion and restraint. You could measure performance related to individuals participating in community activities, related to integrated community involvement or employment. You could also measure calculations related to staff retention or staff turnover or medication errors. Here are some key questions that can help you use data for performance monitoring and improvement. First, identify what data do you have? We just looked at a list that could help you with this question. But next, also think about what data do you not have that you might need. There might be something about your program or services that you want to better understand, and having that data could help you. Next, what is your data telling you? What's going well and what needs to get better? Next, think about how frequently can you review your data? Is that frequent enough? Are you able to review it at least quarterly? Could it be helpful to review it monthly even? Think about how you could do that. Next, identify who's going to collect data and track the improvements. It's important to be clear about who is going to do this and that it is part of their job. Next, a key question, what does success look like? This might be a team discussion because you may not know at the beginning what is a successful outcome. Say your result is currently at 40%. Is that good or bad? What does success look like to you? And finally, how can your data be made transparent to internal and external stakeholders? Answering this question is also part of a team discussion. And think about who could really benefit from knowing and understanding this data. And we want to hold ourselves accountable to our stakeholders, maybe including individuals and families and others in the public sphere. So how can you do that? These questions can really help you. We're going to look at a fictitious example of using measurement and answering those key questions. Remember that a measure helps to monitor your progress towards your goals and objectives. In this example, the team has the goal to improve staff retention from 50% in 2024 to 75% in 2025. They have decided that their measure is going to be staff retention, measured by a denominator being the number of staff who were in their position as of time 1, the beginning of the year, January 1st, 2025. And the numerator is going to be the number of those same staff who were still in their position as of time 2, the end of the year, December 31st, 2025. So let's see how this team answered the questions. What data do you have? They have the number of staff in their positions as of January 1st, 2025. What data do they need, but they don't have? They need to start tracking in an ongoing fashion the number of staff who leave and why they leave. What is their data telling them? It's telling them that in 2025, half or 50% of the staff left during the year. In terms of frequency of reviewing data, last year they looked at the data for a 1-year period. They want to start calculating this at least quarterly. Who is going to collect data and track the improvements? They have an improvement team, and they will track staff retention and do the calculations at the team meetings. What does success look like? They have determined success looks like achieving 75% of staff staying at the organization this year. They want to make their data more transparent by sharing it at staff meetings. Measuring something consistently and tracking it over time will help you determine which issues are problems, which are going well, and what needs improvement. It also helps to monitor your progress towards your goals and objectives. It's helpful to look at your data as frequently as possible so that you can detect changes as close to when they happen as possible and be able to intervene. Also, looking at data more often helps to show you accurate patterns. Look at this graphic. Imagine that a team was trying to improve the outcome from time 1 to time 4. If they only looked at the data during time 1 and time 4, they would probably assume that they had achieved success. But they would miss the patterns occurring at time 2 and time 3. In the first figure, uncovering time 2 and time 3 reveals that there was a steady increase in the outcome, likely showing that their improvement efforts were successful. In figure 2, however, this reveals an up and down pattern at time 2 and time 3, which also could have occurred. And this probably means there was not actually improvement, that there was something else going on during this time that affected their data. Similarly, in figure 3, time 2 and time 3 show no change, followed by a dramatic change at time 4. This likely means something else happened to result in improvement at time 4, probably not what the team was doing to achieve improvement. Now that we've reviewed concepts like baseline data, how to get your data, and how often to look at it, let's talk about setting measurable goals and objectives. We're going to talk about SMART goals. SMART stands for specific, measurable, achievable, relevant, and time-bound. Each of these things are important when setting a SMART goal or objective. So when we talk about something specific, we want to make sure it is narrowed enough so that people understand what it is we're trying to improve. Measurable, of course, means that we need to have some data associated with it, both baseline data and a goal. It needs to be achievable and relevant to your programs and services and have a time associated with it, meaning by a certain date you want to achieve that. There is a fill in the blank on this slide that might be helpful for you. By blank date, we want to improve blank problem from baseline data, fill it in, to our goal data. For example, a statement might be, by December 31st of 2025, we want to reduce the percent of individuals who experience a fall-related serious incident from 20% to 10% or less. Now let's do an activity. On the left, you will see 3 unsmart objectives. I want you to pause the video and for each one, talk about why it is not smart and how you can make it better. Write a smarter objective and we'll see how you did. Let's start with the first one. Our unsmart objective is all new staff will complete orientation. Our smarter objective is by June 30th of 2025, 100% of new staff will complete DBHCS required orientation within 15 business days of hire. The baseline in 2024 was 60%. All right, so they have a baseline. It's very specific. It's measurable. They might think it's achievable. They might need to discuss that. Definitely relevant as it is a requirement, and it is time bound. Let's look at the next one. We want to reduce the rate of serious incidents. Well, that is very vague. So a better one might be, we want to reduce the rate of serious incidents, level 2 and level 3, related to falls from 10 per month during 2024 to 5 or fewer per month by December 31, 2025. They've definitely made this more specific to falls, and they have a baseline there. It seems achievable and relevant and time-bound. Their last one here is the unsmart objective is achieve 0 allegations of abuse, neglect, and exploitation. The smarter objective is achieve 3 or fewer allegations of abuse, neglect, and exploitations due to elopement by December 31, 2025. In 2024, there were 8 allegations of this type. So they feel like achieving 0 is probably not realistic or achievable. So they made their goal from 8 last year to 3 or fewer this year. I want to point out for these examples, one is using a count, the bottom one is using a rate, the middle one, and one is using a percent, the top one, as their performance measures. As you are looking at your measures with your team, it's important to understand trends over time. Trends over time refers to the overall direction or movement of data as time passes, indicating a general increase or decrease. You'll also be able to notice patterns, which are recurring or consistent behaviors or characteristics with the data, like repeat sequences or seasonal changes. Why are trends over time important? Looking at this allows you to detect patterns in your data that might tell you something important. Is the issue staying the same? Is it getting better or getting worse? It also allows you to compare to other things that may have happened over time that could help explain what you are detecting. Could weather or time of year play a factor? Did something happen during a certain time that could impact what you're seeing? Like an organizational change or transition? Did you have a key staffing change? Or did something happen with the individuals that you were serving? These are important questions to ask. In order to be able to look at trends over time, you will need to be able to have like a run chart or a trend line to look at, which is a line graph of data points over time. You will need to be able to also compare this to baseline data, which is numerical data over a set time period that you'll look at as a starting point. Multiple points, as we've discussed, are preferable, multiple weeks or months. At least a year of data for a baseline is ideal. Let's look at some examples of baseline data and SMART goals for providers of developmental disability services. Let's start with thinking about a very small provider that serves 4 individuals. Their baseline may be 2 out of 4 individuals have employment outcomes. And a possible goal could be, by the end of the year, 3 out of 4 individuals will have employment outcomes. For a small provider, it's a little bit bigger. Maybe they are serving 24 individuals. I've done this example with 2 different options, but the same data. So baseline option 1 could be that they had 8 level 2 serious incident reports last year, and their goal could be by this year, they want to have 5 or fewer level 2 serious incident reports. Using that same number of 8 serious incident reports, baseline option 2 would be a rate of 3.3 serious incident reports per 10 individuals, with the goal being a rate of 2.1 per 10 individuals. So they would have to decide which one of those makes the most sense for them. I personally like the rate because you'll be able to more easily compare over time if that number of individuals changes. And finally, at the bottom, we have a medium or a large provider, maybe with 250 individuals served. Their baseline data shows that they had 20 fall-related serious incidents last year for a rate of 80 per 1,000 individuals. And their goal is to reduce fall-related serious incidents to 50 per 1,000 individuals or fewer. So hopefully it's helpful to see these examples. We're going to look at a simple example of a trend over time for the following objective. By December 31st, 2025, 90% of new staff will complete orientation training within 15 days. So here we have the results tracked for each quarter of fiscal year 2024. So this is our baseline data. So in quarter one, it's 60%, quarter two was 50%, then we have 66% and 80%. And for the whole year, 66% of new staff completed orientation in 15 days. So you can see that this is a trend over time in a table format. The challenge with a table is it's not very visual. So while you can detect changes over time, it's hard to see it. You might prefer instead a line graph. So this is the same exact data for fiscal year 24 of new staff completing orientation within 15 days. The goal is 90%, and you can see that it's gone from quarter one to quarter two and went down, and then it's gone up for the subsequent quarters to 80%. Again, this is the same data looking at trends over these 4 quarters over time, but in bar chart form. So it looks kind of similar to the line graph, except this is in bar chart. So some people prefer the bar chart to the line graph. For some people, being able to discuss data does not come naturally. So here are some questions to help you be able to discuss the data. And it's okay to use questions like this with your team. In fact, it's encouraged. The first set of questions help you discuss the summary of findings. What does the data tell you? What are the highest risks or incidents? What are the lowest? What do any risks or incidents in the middle tell you? Here are some questions to help you analyze trends. What is happening with the data over time? Is there a pattern or any change in a pattern? Is a risk getting better or worse? How do you know? Are there any concerning trends or any improving trends? Why? You can look at potential systemic issues or causes, such as why is a concerning trend happening? Why is it getting better or worse? What are the causes? You might want to do a root cause analysis and discuss what it tells you. You definitely need to include discussion of remediation. What needs to be done to improve the problem you're seeing? Why is it a good solution? What other options do you have? How did you pick this solution instead of something else? Do you need to do a more detailed root cause analysis? To discuss steps taken to mitigate these incidents or updating your quality improvement or risk management plan, you can ask, what have you done? Or what will you do to address the problem? Who, what, when, where, and how did you do it? Will you do it? What do you think will happen once you take these steps? When do you expect to see improvement? Do you need to update your quality improvement and risk management plans? How so? And finally, you can discuss other recommendations. Do you have other recommendations? Is anything working well you think needs to spread to other locations? These questions might look familiar to you because they are part of the systemic risk assessment template offered by the Office of Licensing. This is a run chart that puts together a lot of the concepts we've been discussing. For this team, they have been looking at the rate of choking-related serious incidents per 1,000 individuals for the calendar year of 2024. Keep in mind, this is not real data. So they've been tracking this for each of their houses and across all of their houses. And they determined that the baseline from January to July was an average of 7.7 choking events per 1,000 people. They use this to set a measurable goal and objective of having 3 or fewer choking incidents per 1,000 people. They began their intervention in July and have seen a definite decrease. And so far, during their intervention period, have had a average choking result of 3.4 incidents per 1,000 people. To wrap up this video, I want to share a tool that can help with looking at risks and tracking them over time. It is located on the Office of Licensing website, and it is called the Excel Risk Tracking Tool. There are two versions available, one that starts with entering risk events for individuals, and one that starts by entering monthly totals. This tool can help providers meet a number of licensing requirements. There is a preset list of incident types to track, like falls and urinary tract infections, but you can also add your own. It is customizable. It includes level 1, level 2, and level 3 incident tracking, and also care concerns. It also includes a guide to help you have monthly and quarterly conversations about your data. And new this year in 2025 also includes a systemic risk assessment template. It has auto-populating graphs that you can use to track trends over time. And if you don't already use something for this purpose, it is highly recommended that you use this tool. That brings us to the end of this video. Hopefully, after watching this video, you are able to explain why providers need to use data to track performance, describe important data-related terminology, list what data you have available, identify at least 3 ways to use data for your program, and explain how to look at trends in data over time. I want to thank you for taking the time to review this video and wish you the best of luck on your data journey.